Is it more common in male or female, or like vice versa in children?
An excellent question. In fact, I was actually waiting when you would come to that question. Now, every disease does not present the same way in both the sexes. For example, obstructive sleep apnea. When you talk about obstructive sleep apnea and you talk about the male, you are talking about a huge person who's slightly on the obese side, who may have a chin which has gone back, or somebody who's got a big waist, who has a very high BMI. These are the typical or cardinal signs of a person having obstructive sleep apnea, or the cardinal male when you look at that person. But it is not exclusive to the big fat male. It is also, it can happen to people like me, for example. If you have, the problem is about the tone of the upper airway. It is not about how the person looks. Similarly, in a woman also, it's the same thing, because women are normally not as big or not as obese as men. But till menopause, they are guarded by estrogen. The moment they hit menopause, the symptoms or the disease, which is obstructive sleep apnea, can affect men and women the same way. However, in men, the symptoms of obstructive sleep apnea are more like excessive daytime sleepiness, having brain fog, having symptoms which are tend to be more lethargic and dull and things like that. Whereas in women, the symptoms or the presentations are very different. In women, the problems are more again fatigue, symptoms which are related to dizziness, symptoms which are related to facial pain, body pain. More often than not, most women, the obstructive sleep apnea presents in symptoms which are very vague. Like I just alluded to, that means a facial pain which is not getting controlled with any symptom, lack of concentration, feeling listlessness, not having slight dizziness throughout the day, not being able to concentrate. When they sit up and get up, having slight dizziness, cold, clammy feet and hands, so on and so forth. In fact, the symptoms that we need to ask a woman when you are suspecting sleep apnea in the premenopausal age group is very different than the symptoms and signs that you would look for in a male for obstructive sleep apnea.